Bismillah ar-Rahman ar-Rahim. This video is gonna talk about iron deposit scoring. So first of all, what we will discuss really is hemochromatosis, because iron deposit scoring happens in such condition. Okay, I am a novice at this, so please correct me if you know anything else. So hemochromatosis is an excessive iron accumulation by its name, and this excessive iron accumulation makes, so if it's too much in the serum, it will not have a place to go outside the body due to iron problems with metabolism of iron. Okay, so the body is not able to get rid of that iron, so it deposits it in multiple organs, particularly the liver, which is our topic, and the pancreas is affected, the heart, the pituitary gland, the joints, and the skin. So if we can draw a diagram, a small thingy right here, so we've got this guy, he's the poor guy who's got everything. Okay, so there is his liver, why his legs are so long. Okay, so this guy, okay, so his liver is affected, the pancreas, okay, the heart, and then the pituitary gland, and what else did we mention? His whole skin and his joints. Okay, so that's how many systems we've got. One, which is this. Okay, that's one system we can think about, and then the heart, and then the skin, that's three. So 1, 2, 3, skin, and then joints, that's 4, and then 5 is the pituitary gland. If you want to think about it, it can be 5 things. The pancreas is so closely related to the liver because it's a adjunct to the gastrointestinal system, so you can remember both together. Joint and skin together, heart and pituitary gland probably are of the central nervous system and the heart, vital organs basically. So most common hemochromatosis disease is due to hereditary hemochromatosis. So it's not sporadic, most commonly it is hereditary. Okay, and the mutation specifically that is important to remember is HFE. Okay, so FE, as in you can remember it as the iron is Fe. I'm not sure of what that stands for exactly, but it's called HFE, associated hemochromatosis. Okay, I've shortened it here. North European ancestry, so people from North Europe are mostly affected, and it is an autosomal recessive, so we've got one pair and there is another pair, so autosomal recessive. Okay, I'm not exactly certain, so autosomal recessive. In any case, men are affected before women, because women have a way to dispose of their iron through pregnancy, menstruation, and other things that women have, and because they generally do not have as good of a iron storage as men, because men are able to store more iron normally than women. I think that could be a factor as well, but generally because they lose more iron than men in the menstruation years. So what are the clinical features? Clinical features, they might be asymptomatic and early. If there is iron overload, they can become fatigued, weak, but then their organs are starting to get affected. Their liver becomes large, okay? Their pancreas becomes involved, and then they might get diabetes mellitus. So that would be probably type 1 diabetes mellitus due to the destruction that's probably gonna happen. Okay, whatever it is, it's diabetes mellitus associated with hemochromatosis, if you want to say it like that. I'm not sure if it's type 1 or type 2. So skin hyperpigmentation is something else that could happen due to affecting the pituitary gland, probably but I'm gonna say because the iron will be causing the hyperpigmentation of the skin. Who cares about explaining these things? But arthropathy can happen, and it can specifically affect the second and third MCP joints. The general idea is that these areas can be affected. So the patient can have hepatomegaly, fatigue, weakness, can develop diabetes, his skin is dark, his joints are hurting, all right? Advanced disease can involve cirrhosis, which can go into hepatic cellular carcinoma, okay, hepatocellular carcinoma, cardiomyopathy because it affects the heart, and hypogonadism because it affects the pituitary gland. Okay, hypogonadism is basically your gonads become smaller or, you know, less functional because you're not producing as much of those central nervous system endocrine, you know, the endocrine hormones that are produced by the pituitary gland. I don't remember, I can't recall their name right now. So the lab tests, we check the iron. Transferrin saturation will be high. Ferritin is not specific, but is nice to have. Okay. HFE genetic testing is gonna be really helpful for that patient's family because they might have mutations. There is the particular C282Y, if you wanna remember it. But the idea is it's important to give an idea about to the clinician because the family can be affected as well, and this can be, you know, yearly and asymptomatic. You can test it with the laboratory tests and you can treat it before something happens. You know, they have to donate their blood every time. That's the treatment, if I remember right. So there is the important part for us in here. Okay, mumbling around too much, sorry. So liver involvement. So we needed to know about all of this before we understand what the biopsy is taken for. So the biopsy is taken for confirmation of the diagnosis that there is a good amount of deposits in the liver, and liver involvement is a hallmark for this. So other organs can be affected, even the kidneys, I've heard, can be affected. What do? We look at the H&E routine stain, and we can see that there is a coarse golden brown cytoplasmic granules, particularly within the hepatocytes. Let me bring up a photo. Okay, so this photo really tells us what the hepatocytes look like. Okay, so you can see with this, all right, you can see that these hepatocytes with their nucleoli, fine chromatin, there is a lot of deposits that are brown. Okay, they can be golden, they can be brown. This is called hemosiderin, and it also can be iron. Okay, hemosiderin / iron. It could be other things. So the best thing to do is actually to make sure that we do the correct stain. And the best stain that I know about, is Pearl's Prussian blue stain. Okay, Pearl's Prussian blue stain. Okay, BBBB. Okay, PBPPB, if you wanna remember it like that. So what does it stain? It stains basically the stains ferric iron or hemosiderin. Okay, it allows the distribution and severity of hepatic iron deposition to be assessed, obviously. So what do we do? How do we score it? That's the main thing in here. So Iron accumulation, it starts at the periportal hepatocytes and then extends through the lobule. Okay, extends through the lobule. With advanced disease, it can show fibrosis and cirrhosis. This is another thing that we should be aware of as we score this, because we need to look at the periphery, okay, the periportal hepatocytes, at the portal tract. Portal tract is going to be at the ends of the lobules, okay, at the part. So you have your central vein in the middle, okay, you have your central vein, and then around that central vein you have those portohepatic tracts where your iron deposits are going to start, and then eventually they go in other sites. Okay, I think that's a central vein as well. So in here we can see that there is the grading system. There is two grading systems. There is Schooner's classification, which is easier if you want to remember it, and there is Dugner's and Turlin histological scoring. Okay, both of them are going to look at the histology. However, this one is more specific and very very aggressively talking about exactly where they are. Okay, yes, so the scoring system for grade 0, absent. Okay, so you cannot really see anything at the greatest magnification, so it's absent. Okay, granules barely there with grade 1 at 250 magnification, whatever you want to call it, if you're going on 20 magnification or 10. So you can think about it by the number 5. So at a little bit of high magnification. Okay, so easily confirmed at 100, but at 250 granules are there. Okay, grade 2, granules discretely seen at 100 magnification. Okay, so at 100, which is times 10, not too much, that's easily seen. Okay, at grade 3, we're going now into the lower power ones, so we can see them very well at low magnification. And at grade 4, at this point we might be able to see them with the naked eye, so we can probably make an iron suit of this liver. Okay, so that's the idea. It's absent, or at a higher magnification we can see so much, or at a lesser of a higher magnification, or at a low power, or at the lowest power, or barely seen by the naked eye. Okay, now with this one we can see that there is a good amount. Okay, maybe in the image C shows us that there is a very nice amount of hemosiderin, and this is stained by the pearl Prussian blue stain. Okay, so this is really good. This is really good for diagnosing it as a grade 3 or a grade 4. I'm not an expert at this, but I'm just saying that this is a coarse amount of hemosiderin. Okay, coarse blue granules of ferritin and hemosiderin in the hepatocytes. C and D autoptic liver sections reveal heavy iron deposition in hepatocytes. I think they have a scale in there, which I'm not really sure how we can use it, but I think that with this Dugner's and Turlin's histological scoring, this will be useful to score with the millimeters, I mean micrometers at this point. Okay, Hepatocytic iron score, okay? So with the Dugner and Turlin histological scoring, so DNT histological scoring, they are more specifically talking about where exactly this iron is. Is it at the hepatocytes? Is it at the sinusoidal areas? Or is it at the portal iron, portal tract? So portal iron, okay, so portal means macrophages, biliary cells, and vascular walls, okay? So in the hepatocytes, it's scored until 63, and then in the other two, it's scored until 12, okay? And of course, there is that severity. I think that there is much more to this, with scoring of probably mild, moderate, severe. Let's look at it. Okay, so I looked it up and there doesn't seem to be anything to actually associate with the numbers. So if we're talking in specifics, we can say that from 0 to 5, okay, that is the useful thing, okay, and above that is normal, all right? So from 0 to 5 is normal. Above 6, okay, above 6 or 6, that is abnormal, okay? And then after that, that is just severity, I guess, but we cannot really put something that they didn't mention, so I have no idea. It could be that it's just mild, moderate, severe, but I'm not really sure. I couldn't find anything. So that's it. I think the best thing to remember is the type of stain and that there are two scoring systems. Maybe if you can remember that Schuer's classification or grading is going to be specifically based on how much you can see on the magnification that you're in. As much as you are going into a higher and higher magnification, that means that this is a lower grade or a lower score, if you may want to say that. Okay. With this one, Dugner's and Turlin's histological scoring, it is really difficult to try to remember what these represent, but you can remember that they talk about hepatocytes and how much granules are there, and then sinusoidal, okay? So hepatocytes, sinusoidal, and then the other cells that are there, okay? Macrophages, biliary, and vascular, okay? Vascular walls. Of course, vascular walls means that they are in the collagen or in the cells or whatever. These images are good to be recognized, and the type of stain is again Pearl's Prussian blue stain. This is what you see in HND. And I thank you very much. Hopefully this was helpful.